My name is Alba Osorio, and today I will be talking about schizophrenia. Schizophrenia is a chronic brain disorder that, unlike other disorders such as depression or bipolar disorder, uh, does not have as much information, though research is being done on this disorder. And every day and over time, we will be finding out more about if there's any uh, genetics have at play something to do with it, um, what other risk factors could be contributing to people having schizophrenia, and so on. Schizophrenia is a brain disorder that usually, when discussing about its symptoms, tend to be having a hard time perceiving what is real and what is not. Um, Tends to have speech problems as well as memory problems. Delusions is a symptom. Psychotic episodes are a symptom. Feeling catatonic is also a symptom. And overall, uh, having hallucinations. With that being said, the symptoms of schizophrenia and experiencing schizophrenia is different for each individual. Some people may have certain symptoms that may be common, and they just may not have it. For example, when talking about categorizing these symptoms, there are positive symptoms, which means they're abnormally present. Negative symptoms, um, symptoms that are abnormally absent, and then unorganized symptoms, or disorganized symptoms. Now, for example, one of the most common symptoms of schizophrenia would be being able to hear things or see things that aren't there. Um, that would be a positive symptom. Whereas if you want to discuss about a negative symptom would be categorized as a uh, be not being able to speak, um, or express some sort of emotion. That is more so a negative emotion. And then lastly, a disorganized symptom would be having trouble remembering things, and uh, sometimes it even expresses physically, having some bizarre physical behavior or movements. Now, the prevalence rate with schizophrenia is kind of hard to decipher since, when it comes to some research, it tends to be combined with other psychotic disorders. So, according to the National Institute of Mental Health, it says here in the United States, the prevalence rate between among schizophrenia and other similar psychotic disorders um, tends to be within 0.25 and 0.64%. So that would be the prevalence rate for schizophrenia. Now, as for treatment for this disorder, um, there um, there is a lot of cases in which the best sort of treatment would be taking um, antipsychotic medication, um, as well as seeking therapy. Um, that tends to be the most common sort of forms of treatment. And although these may be the most popular methods to treat schizophrenia, there are being more research done and more tests are being conducted in order to find other ways to treat this very complex disorder.